Question number 2. My son is in elementary school and has selective mutism. So far this year, he's been leaving his test blank. It seems like he doesn't even want to try. Why does a child with SM do this?
Another really great question. We always are assuming selective mutism is about speaking and not speaking. And I know I reiterate that a lot, but it's just so common where people focus only on the speaking and getting a child to speak. But there's so many different aspects to this child and how he is presenting. As I say often, we need to look, listen, and learn. So here's the question. What is your son telling us by this avoidance? In my experience, there are reasons why a child is avoidant of schoolwork. However, I do have a few questions. One, is his avoidance of tests in one particular subject or in all subjects? Two, does he typically start and complete work on time when in class and it's not a testing situation? Does he do his homework with minimal effort at home, or does he resist or become frustrated with homework? And again, is it limited to a particular subject area of learning? The answers to these questions are needed to gain more insight. If he is fine, quote unquote, when in a non testing situation, he starts, he completes work on time, and does his homework with very minimal effort or frustration, then he is most likely manifesting test anxiety. Therapy would absolutely help here, and perhaps school accommodations for more time, different testing environment, etc., and working closely with the school to help minimize that anxiety and to determine with him why he might be feeling anxious. Another question. If he is having challenges starting schoolwork on time and doing his homework, for example, he avoids, he gets very frustrated, or does not complete it, and it's often a battle, then we need to evaluate him for learning challenges. If this goes unaddressed, increased avoidance, frustration will only increase, especially as he sees others doing his work and completing assignments. This will negatively affect his overall confidence, self esteem, and cause less social communication functioning. So his selective mutism symptoms will only worsen because his anxiety and frustration are increasing. You can request an evaluation via the IEP team and or get this testing done privately. If a school system is not able to assess because your child is mute and isn't able to use his words, and they don't know or have the skills, they just don't know how to accommodate him, you can request an independent educational evaluation by an experienced center or clinician who knows how to accommodate a child or a teen with selective mutism. I will say this is something we spend a great deal of time with at the Smart Center. Our evaluations, whether it's psychoeducational evaluations, specific learning disabilities, differences, autism spectrum, it really is like the full gamut of what we test for. And why we do that is kids with SM are not just mute. We do see some of the Ys having processing difficulties, having some learning challenges, and that is affecting their give, take, back, forth of social communication. It's also in combination with maybe social anxiety. Maybe they have sensory processing challenges. So, all of that might be causing them more stress and anxiety. But if we're assuming they're not doing their schoolwork or they're not doing their tests and that's selective mutism related, I would say, what does that mean? Because it's not about SM doesn't cause anything, SM is a result of. So, if your child is challenged in school, and it's affecting their ability to function in school, we need to have them evaluated so that we can provide appropriate accommodations and interventions that will also incorporate social communication accommodations and interventions.
Just as a follow-up to that, I'm curious, what happens in that environment when when a student isn't doing their test, completing their test? Essentially, they're failing the test. What does the school and the teacher usually do? Do they just fail the student, or do they sort of work with the school and the parents to figure out, like, can they come back in and take it? Like, otherwise they're just going to get, their whole semester or their whole school year could be altered negatively because they're not taking their tests. So what happens?
Well, in an ideal world, we want to look, listen, and learn. What is this child telling us? I do hear too often almost like a frustration, like he's refusing to do his tests or refusing to do schoolwork or he's choosing not to do it. And
So
I
are they
really,
failing them?
well, that's what I'm trying to say. Not necessarily. There are some that expect them to do it and they're questioning why. Is this a choice? Are they being defiant? Are they being oppositional? That's worst case scenario. Best case scenario is the look, listen, and learn. What is he telling us by him not doing it? So, in an ideal world, what I would tell a client, a patient of mine, the family, is we need to figure it out because no child wants to fail. No child wants to refuse their schoolwork. If they're not doing it, there is a reason, and we need to figure out that reason. And so sometimes it's our patients, the families, that have to go to the school and state, and sometimes we write the letter for them or guide them through the letter writing process, and or I'll just write a letter and say, this is what I'm seeing in my evaluation. I highly recommend an evaluation because of X, Y, and Z. And so we get the ball rolling. In an ideal world, the school would be coming forward and saying, quote unquote, Jeremy's not doing his tests. We're really concerned. We need to meet together. And hopefully, with the clinician this child is working with and the family is working with, they can guide them to get appropriate testing and figure out why. Because if we assume it's a choice and we're failing them, all we're doing is creating this vicious cycle of, and then it leads to more anxiety, depression, school refusal, et cetera, et cetera. So the whole goal is to figure it out and to help and support that child, not to make them feel that they're doing it on purpose and it's a choice. Because in all of my years, which at this point is a lot of years, I've never seen a child choose to fail or choose not to do their schoolwork. It's always a message that something else is going on.